Hey guys, Mark here with Ultimate Performance Training. This is part 2 of our knee pain series. We're basically going to focus on the hip today. The reason is because last time we focused on the foot and ankle, and now we're going to focus on the hip. And if you notice, the knee is caught in the middle with no place to go. So if we have a dysfunctional foot or a dysfunctional hip, chances are the knee is going to pick up the slack and do more of the work which it's not created to do. So a way to really help you guys with that is, a lot of times most people struggle with what's known as hip extension, especially on one side or the other. And so what will happen is, a lot of times, whenever you see people walk, they'll walk with their foot kind of toed out a little bit. I'm super exaggerating, but they'll basically have what's known as a heel whip. And they won't, and basically, instead of not being able to have that good extension or also internal rotation of that hip, the foot compensates, and therefore the knee takes the hit. So we're basically teaching how to basically stretch and also strengthen and condition the hip in all 3 planes of motion. So if you have a chair, if you have stairs, just basically find some place where you can put one foot up, elevate it a little bit, and have a nice place where you have a good 4 points of stability. I have 3 points of stability right here just for the time purposes, but you're basically going to have you're basically going to use your hip and drive it forwards and backwards over this foot. And so you basically want to make sure this foot is either pointing straight ahead or also toed in just a little bit, depending on how successful you are in maintaining this position. So you're going to drive forwards and backwards, getting just a little more extension each time over that hip. Let's do that about 6 to 10 times. Second thing you'll do is you'll basically kind of find your in range going forward just a little bit, and then driving your hip side to side. So this is creating really good mobility in what's known as the frontal plane, which is all of our side-to-side movement that comes from our hips. And then lastly, we'll add a little rotation. So we'll act like you have an imaginary hula hoop along your belly, and you're rotating one direction, and then go the opposite direction, like so. So each of those stretches you can do about 6 to 10 times. They're great, especially if you've been sitting for a long period of time, because of course what will happen is, if you sit for a long period of time, your hips just sort of get kind of shut off, and then what will happen is your body's so stuck in this position that you'll basically sort of stand up, and now you have a really hyperextended lower back, and your hips are still anteriorly rotated like this, so it's putting more pressure on your lower back as well as your knees. So highly encourage you to do those stretches against the stairs or in a chair, or just find some sort of elevated surface for you to put that one leg up and really go after that hip. Second piece I want you to go after is getting some extra stability out of the hip. So now, after we've created some mobility, we're going to create a little bit of stability from the hip. So to basically create a little more extension, we're basically take a little step back, and then reach overhead, and then come back. So basically keeping that foot directly pointed straight ahead. You're going to reach over with the hands and up, and then come back. Put all your weight on that back leg and come back. Just reach straight up and come back. Do that about 6 to 8 times. Second thing you'll do is just reach side to side. So you'll come back here, and then side bend to the left, then alternate your arms, side bend that way. Again, about 6 to 8 times. Then reach as well. And the last piece, we're going to have a little rotation. So we'll take a step back here, reach with the left arm going to the right, step back here, reach with the right arm going to the left. And so this will teach the hip to be able to rotate better over your femur as your foot is pointing straight ahead, so we can really get that really good rotation in your butt, in your hip. There you go, step back, and then rotate. So these are a couple of simple strategies for you to do at home, which will take you no more than about 4 or 5 minutes at a time. Try and focus on doing it every single time you go and eat. So if you eat breakfast, lunch, and dinner, do this right before or afterwards to basically create some a little better motion in your hips, and your hips will thank you greatly for that. So anyways, hope you guys enjoyed it. Let me know if you have any questions. Feel free to contact us on our website. Thanks for listening, and we will talk to you soon.